real time by the Duxbury Government Access Channel, which is Verizon 39 or Comcast 9. Viewers can visit www.pactv.org/Duxbury for information about Duxbury programming, including streaming on Duxbury YouTube. All right, we'll call to order. And our number one item on the agenda is 25 through 28 Trout Farm Lane.
Good evening. My name is George Collins. I'm a registered professional engineer from Collins Civil Engineering Group. I'm representing the Trout Farm condominium complex. Would you like me to proceed with things?
Yes, please.
Okay. Yeah, so basically, would I be able to share my screen?
If you could do so, I think that would be useful.
Okay, here we go. Shared screen. Let's see. Can you see that screen and its pointer here?
Not yet. Oh,
No?
There you go.
Oh, okay. Okay, you can see that now? Can you folks see that?
Yes.
yeah.
Yeah, so so basically this system was inspected a couple months ago, and they found that there's two leaching pits, and one of those leaching pits were flooded, and the distribution box was flooded. So a Title V inspector deemed that the system was in failure. So I was contacted by Heather Ali, who's a chairperson on the board of directors for the condominium complex. I gave a proposal to provide the engineering services to upgrade the septic system. I'm going to zoom in a little bit here. So this is it right here. This is an 8-unit condominium complex. It's 4 units, which each of them have 2 bedrooms. So it's a total of 8 bedrooms and a 4-unit dwelling. And this system was designed completely backwards. And to make a long story short, this is the low part of the property. These are the contour lines. So there's a substantial, like the back of the property, it's elevation 29. And then up where the system is approximately elevation 50. So there's literally like a 20-foot elevation change from here to here. When they built these condominiums, they put the living space on the basement floor. So the kitchens, the bedrooms, the bathrooms are all on the basement floor. All the plumbing goes under the basement floor and comes out the front of the building, and which put all the septic components over 10 feet in the ground. And this is how they built it, back in 1978 or whenever it was constructed. You would never build this way. Now it does not meet code. You're not supposed to have septic components that deep in the ground. So, and then this is the lot line, and Tracy and I went out there, took a close look at things, and just the way the topography is set up and the existing plumbing coming out the front, we had no option but to put the system in the same location. So what that's requiring us to do is so currently, excuse me. So this is basically what the pipe comes out here and goes into a new septic tank and a new pump chamber, and then that pumps up to the leaching field. So we had to hold the existing pipe coming out of the building because, again, the plumbing is all under the slab, which is making it so these tanks are really, really deep in the ground. In fact, about 12 feet, which is similar to, they're the same elevation in the ground as the existing tank. And we really have no option with that. So we're requesting a local upgrade approval, allowing 144 inches or 12 feet of cover over these septic tanks. And then we're also, the way we have this leaching field positioned, a portion of that leaching field is going to have approximately 42 inches of cover over those units, and the maximum is 36 inches. So it's just, we're asking for an extra 6 inches of cover over these septic components. So again, to accommodate the existing plumbing, the existing geology, water table, we were basically forced to go this route. And Tracy and I discussed it. We can, agreed that this is definitely the way to go. And so we're this triggering these local upgrade approval requests. So again, we're requesting a local upgrade approval to allow 12 feet of cover over these tanks. And then we're also asking for a local upgrade approval to allow 42 inches of cover over the leaching field itself. And the maximum is 36 inches. So that's just a 6-inch variation from the code. I'd be more than happy to answer any questions that the board may have.
George, I was wondering about the 12 feet of cover. Are there any specifications from the manufacturer in terms of amount of cover that can be supported on top of the tank?
Yes, I actually have language that's requiring the tank vendor. We're putting in what's called H20 tanks, which are the heavy duty tanks. Which once you have more than 3 feet of cover, you'd go to that. And then so I do have specifications, structural specifications that the vendor is supposed to provide us, that they're structurally adequate for their intended purpose. I can, if you want, I can find that note on the plan. It's not on this plan. It's a different sheet if you'd like me to show it to you.
Yeah, that would be great. And if we could get a copy of that when you do.
That's all part of the plan set. That's a 2-sheet plan set. So it's just sheet 2 of the plan set that I submitted. And I'm trying to see here. Let's see, new share.
Yeah, it says these tanks are concrete.
Yes. Okay, tanks.
I see note number 10 indicates system components to withstand H20 loading criteria.
Okay, I'm sorry. Was that on my first page? Did I go on the wrong page?
No, that's on the second page. You're right.
Okay. Yeah, so that, like I said, and once I find out the vendor, because different contractors are talking to different vendors, we'll coordinate with them and make sure that the structural specifications are met. But again, that's what's there now. There's an existing concrete tank with existing concrete risers, and we're basically going to be doing the same thing, but with what I would consider a much better modern product. Back then they have what's called the American Standards of Testing Materials. There were no specifications for tanks back then. That was kind of very loose how they did things, and now we're using, now there are ASTM requirements that, the way they make the tanks, and they have quality control processes. So what's going in the ground is going to be superior to what's already in the ground. And this system's been in the ground for 40 years or 35 years.
Can you describe once again how the failure of the current system?
I don't have a lot of this. I believe they provide me with the Title V report, but it's I spoke to the Title V inspector. It's my understanding that one of the existing system is serviced by 2 pits, and one of those pits was full, and then the other And then the distribution box was also flooded. That's
And
my,
it's flooded from the groundwater?
that's my understanding. I'm sorry, what was that?
Flooded from the groundwater?
Presumably, no, it was flooded by sewage. 'Cause like I said, these tanks, even though they're 12 feet in the ground, like I said, we have below down on the slope. It's over 20 feet down, so there's the groundwater is very deep here. So these tanks would not be impacted by groundwater at all. Because of that
I just
substantial.
wondering because of that note that's on your drawing that says that the groundwater was breaking out at 19 feet.
Yes, yep, that's elevation 19.
Yeah.
And then again, so let's see, let me just zoom in a little bit. So you get the invert into the tank at 38.
So that's 30 feet.
That's
30
20 feet above the weeping.
Yeah,
That's 20 feet above elevation 19.
yeah.
So groundwater is substantially deeper. So I mean, this is really ugly. It's an ugly project. My firm did 205 septic repair designs last year. So we do 3 to 6 of these a week, and this is obviously very bad conditions, but unfortunately there's just engineering and construction decisions that were made 40 years ago that are fighting us today.
Madam Chair, if I may, it's Lauren. I have the Title V in front of me. So there's actually 3 pits, and 2 of the 3 pits, the liquid level is over the inlet pipes and pit cover openings. And then the 3rd pit was dry with no signs of receiving flow. That's from the failed Title V.
Thank you.
One other question, it looks like you have utility crossings right at the building, essentially next to the building and before the D box, is that right?
Go back to that sheet. There's utilities that wrap around this way.
Oh,
There's no direct, other than underneath the vent pipe, there's some utilities going from a transformer to the corner of the garage. But there's no direct conflict with any utilities, the way this is laid out. We have the water and underground
okay,
runs through here. This is that's a communication line. That's a Comcast line right here.
got it.
So we have it set up. So again, we had it marked by DigSafe. I also have some supplemental language about the contractor hiring a private utility marking company, in addition to calling DigSafe, just to dot our I's and cross our T's.
Okay.
Yes, and I apologize that it's 2 flooded pits, but there's 3 total. I apologize. This is an existing pit, that's an existing pit, and that's an existing pit. And apparently two of the 3 were flooded.
What's a trash tank?
That's the existing tank that's in the ground. That's an existing 1,500 gallon tank. So what we're doing is we're leaving that tank in place, and that will be pumped just like the regular septic tanks. So basically that's going to be some initial treatment, and because we're not taking credit for it as an actual septic tank, I'm calling it a trash tank. And then that'll go into a new septic tank, and then the pump chamber set up. So
Is that tank also a heavy duty tank?
yes, yep, that has an 8-inch top on it, which is a H20 tank. The other thing that we're doing is we're
So
right now.
it's been there for a long time.
Yes, yeah. The problem is this is right in the middle of everything, right in the middle of the water line, and it's actually depressed area right in front of, so it's sort of a cost benefit analysis of do you remove it? Or decommission it, or do we just use, keep it in place and take advantage of, the treatment, characteristics that it will provide? So basically you'll get some initial treatment and then you'll have a 2-compartment tank set up. It'll have double settling here, so it'll technically be triple settling, and then it would go into a pump chamber. And then pump up to, I have it set up so it's actually dosing. There's 2 distribution boxes with dosing, a dual alternating pump. So this will alternate pump to this distribution box and then to this distribution box, and alternating, which will give us good, even.
Does the current system have a pump?
Excuse me?
Does the current system, the system it failed?
No, it's all gravity.
It's all gravity?
These pits are 20 feet in the ground. Yeah, it's crazy. I've just never seen, and they have risers coming up to manholes in the parking lot. I've never seen anything like it.
Excuse me, Karen.
I'm sorry,
I hopped in a few minutes late. Am I allowed to comment on this one?
You are allowed to comment.
Okay. First of all, it's a lot of work in a nasty situation. Good job.
Thank you.
But I do have a couple of questions that looks like I jumped out and in. Can you hear me again?
We can hear you.
Okay,
So
sorry. Sure, this isn't
the
very clear.
second variance is the distance is on that corner there where the garage. Is that where the issue is, on the property line and the beach field?
Right here, yes, that's right. I apologize. Yeah, so we have we're requesting a 6-foot setback to the garage slab. I apologize, I missed that. I'm looking at my paperwork right here and it's right in front of me. I apologize.
Yeah, that's okay.
And it was really just, we needed that extra 4 feet. You're required to have 10 feet. We needed that extra 4 feet again to just keep us away from these utilities and give us a little bit of room to build it. And there was also language on the plan regarding providing a comprehensive safety plan and trench box plan to notify the fire department and the Board of Health, because this will be access will be temporarily cut off here during construction. So we want to make sure that the fire department's aware of that. Also to coordinate with the unit owners, just again, so we have good communication during the whole process.
So with the additional cover, I think it's 36 to 144. What are some of the potential risks to the system components?
If they're strong enough, which again, these are all H20 concrete components, then there's really no risk. Maintenance obviously is going to be a little bit of a pain in the neck, but we have the full 4-foot manholes with a ladder built in and all that. I mean, which is the way the existing pits are now. So it's just so I mean, everything's deep in the ground. We have a design point again that goes under the slab of the condos, again, because the part of the finished living space is in the basement. So all the plumbing literally goes under the slab and into one pipe and into the system now. So so we're kind of stuck with that fixed design point. And there's just no other way of overcoming it from what I can see.
So you mentioned maintenance. What type of a maintenance plan is
Or
there?
just pumping. You
Okay,
know, you just, but they don't have to go down into the tanks to pump them. But you know, and then you'd also, you know, the only other thing would be, you know, if you ever had to the, replace a pump in the pump chamber. But that's something, if the pumps are set up correctly, you know, pumps should last 10 to 20 years. So that would not be like a routine maintenance. That would be something that would just happen, you know, every 10 years or so. And it's a dual alternating pump system. So if one pump fails, a buzzer goes off and there's a second pump that's still functioning. So again, it's a very ugly situation. And to say that it was anything but that would be incorrect. And we're just trying to make the system work well, with the circumstances that we've been dealt with.
You're leaving the existing tank right outside the front of the building there, yes?
Yes, we're gonna keep that as what I call a trash tank. I have done that on other projects. Just if you have a tank that you either have access issues to it, or again, the cost benefit is not there to remove it, then we don't take credit for it during for the treatment train or the treatment process. But it's basically an extra inline septic tank that will give us some treatment, and then it will go through a two compartment tank series, and then into a pump chamber with the dual alternating pumps.
Were you able to get a rough estimate on the depth of the water line? Because typically those need to be sleeved when they cross sewer lines.
The water line is over here, so the work is all going to start out here. So we're not going to be anywhere near the water line.
No, I understand nothing new is going to be near the water line, but I'm just questioning with how old the system is, if that was ever done.
I don't have any information on that.
Fair enough. That's a tough one. And then did you only have the one monument on the front corner? It doesn't look like property lines extend too far out. as far as
No,
traffic goes.
we also tied into some monuments across the street. We got into a couple different monuments. There's a monument in this direction down here that we got into.
Okay, awesome. Just because it
This
wasn't
plan was
shown.
prepared by a registered professional land surveyor. He's the vice president of my company.
Oh, okay. I didn't see a stamp on there anywhere. And then did we get a sketch? I heard you say it was 2 4-bedroom condos, I think is what you said,
4 2-bedroom condos.
or 4 2-bedrooms. Sorry. How do we treat condos technically? Because this structure looks large enough, and I didn't see a floor plan to see if
There are the
room count.
condominium floor plans, from the condo documents. Those exist. I did not personally go through each unit.
Because I know that if there's more than a certain number of rooms in the house, that we don't actually go by bedroom count. We go by the number of rooms divided by
Yes,
2. Or
that would be
similar to
each
that.
individual unit. You'd have to have 9 or more rooms in one unit. You wouldn't do that with the whole entire structure. You'd do that per unit.
So this is technically a shared system then in that
Yes,
regard.
it's a shared system with 4 different condominium units.
Okay, that
And
makes good sense.
that the room count kicks in after 9 rooms per dwelling, or whatever you would like to call it.
Okay. I poured over this for quite a while because it's a very sticky situation, as you said a couple of times already. And those are really the only questions I had. I did hear you say that there was a Title V inspection that they failed, and I think I saw that it was marked as a voluntary repair as opposed to a failure on the application. I think we can just check the correct box on that. But we should probably have that squared away with the variances from the state regulations going.
Okay, yeah, so what my office, we checked the wrong box.
Yeah,
So-
there's a simple thing like that.
Okay,
But all right, now those are the only questions I really had. Otherwise, you poured over it really well. I poured over it in detail.
yeah, and like I said,
Good job.
what I would like to actually make a condition of, because I think it's in everybody's best interest, is that we get this structural specifications and certification from the tank vendor to make sure, if, that's something that I would like to, if possible, even put into the language of the approval. Just to
That was
make,
going to be my final comment, because you did all the right things with your notes here, saying that it's gotta work. But I'd hate to approve this and then find out that they'd have to go to Connecticut for some reason to get a tank that would actually work, and just be
yes,
something that no one foresaw, kind of thing, or called out for the benefit of the homeowner.
yeah, we did, yeah.
Thank you.
Like I said, so just in general, it's ugly and I'm not proud of this, but I think just under the circumstances, we were kind of forced to go this direction.
Do we have any other questions or comments?
May I, Madam Chair?
Yes.
Hi, Brian Glennon. I'm a member of the Select Board. I'm the liaison to the Board of Health. So I don't vote on this, but I do have a couple of questions for you. If you
Sure.
can put the plan back on the screen. I just wanted to ask a couple of things. One of the questions I have you touched upon, which is the pump to get the effluent from the tank to the leaching field. Given that this is so deep, can you share with us a little bit? You were talking about maintenance. How would those components, or how would any of the components of the system be maintained? Is it going to require 10 feet worth of excavation at some future point, or is there a way to get in there?
So,
I'm just trying to see how this is going to work long term.
Yeah, so a couple things. There's an existing cover to the what we're calling the trash tank. We're replacing, that has a good access, but it's just got a concrete cover, so we're replacing that with a concrete cover with securable watertight seals. And then there's going to be 4 covers on the 2 tanks. And again, these are full 4-foot risers that would provide access. So what I have seen is, because a couple other things, there is a filter, an effluent filter, underneath one of these covers. They will literally have a pole that goes all the way down to the filter. So when they pump it, and then they can literally grab a handle and pull the filter out from the ground surface. So, and then same thing with the pumps. The pumps, they can set those up so they can they disconnect a cup link way up high into the riser, and then they can pull the whole pipe out with the pump at the bottom of it without actually entering the tank. So the intent would be to do all normal maintenance outside of the tank. Just long term, if there was ever a blockage or anybody had to inspect it, we will have these risers. So the intent would be to never go in these tanks and for maintenance to be performed. And then the same thing with these covers. Right now, they just have cast iron covers to grade. We're going to have cast iron covers to grade, but they're securable with a rubber gasket. So again, everything here, you have this really old technology, a really, really horrible design, but it served this place pretty well. And now we're going to go in there with all, with new components, new tech, not that any of it's rocket science, but, newer technology. We're doing the nice old school concrete, flow diffusers, which is a time tested product. I think it's going to work well, and if all goes well, after this thing is built, nobody will have to go into any of those tanks ever.
Okay, that's good to know. As long as we don't have a confined space issue for somebody to get hurt or a big excavation later on.
Yeah.
The other question I had is, since we haven't had a a leaching field on the system, where you're putting it, and I guess you really don't have any choice where to put it, but it's right in the middle of a paved roadway or a way.
Mhm.
Can you explain? And I understand from the plan that it's actually an access and utility easement. So the two questions I have on that is, do we know who holds the rights to that easement? And have they signed off or they been consulted, as opposed to us hearing about it later saying, why did you approve that without talking to us?
Yeah,
And the other is, can you explain a little bit for the board how the leaching field itself is engineered, if there's any special requirements, given that it's going to be under pavement and under heavy loads vehicles?
yeah. So, basically this is one lot with condominiums in it, and there's multiple lots that are all part of the same condominium complex, which are all part of the same master deed. And basically all the utilities are set up right now there is a unit over here. All their utilities come in from the opposite side. This is like a U-shaped driveway. It goes up and there's another unit here. So all their utilities come in this way. All of our utilities come in this way. And then basically you have this 20-foot wide access easement that allows people to pass and repass in common use with the two units. So so I guess unless somebody wants to run a utility through here someday, I don't see any implications as long as, and like I said, I have language in the on the plan regarding notifying the unit owners, notifying the fire department, so they're aware that this is going to be temporarily they're not going to have access. I have language in there requiring safety fence, safety precautions. So I mean, certainly if you think that some additional communication needs to be done, I think we'd be more than happy to, that's in everybody's best interest. But again,
I'm not sure if we do or we don't. I guess my concern
Yeah,
was that, this board's only looking at the scientific end, so to speak, not really the legal rights of individual
Yes,
parties.
yeah.
So
That's
as
something
long
that
as we're all clear that any approval from this board isn't, granting any property rights that didn't exist before.
Yeah.
And that's all I wanted to raise with that.
Yeah, no, and I appreciate that, because that's, good food for thought for myself. So actually, I'm gonna talk to the chairperson. And I'm gonna bring this to her attention and say that we should get a legal opinion on this, just to make sure we all can move forward with a clear conscience.
I did see that easement. I didn't want to speak to it because, like you mentioned, it's not exactly what we're here to look at. But my understanding of how easements go, basically someone else has the right to dig a trench and put a utility line through that easement. And it's really the risk of the owner to put this field where it's designed, because someone has the right to rip it up to put a line in. And, it being all condominium, I'd like to think that wouldn't happen. They'd find another way around it, but there really doesn't seem like there's any other place to put a system that isn't going to cost a ridiculous amount of money.
Yeah, and honestly, I appreciate the board having that additional insight, because I will, I'm gonna follow up on that. Because it's my best interest and the best interest of my customer.
So what happens if there is a problem?
Then we'll have to come back to you with an alternative, which, we could go over here and reroute the water line, reroute the electrical, and go in here if we had to. So if we had to do something dramatic in a different location, we could, and we would obviously come back to you with a new application.
And just to finish up on the thought that I was asking you, is on the proposed leaching field itself, given that it's going to get under pavement, under a road, is there anything that this board should know about either the engineering or the maintenance or the use that's different from, a typical residential system under grass?
This is an old school concrete flow diffuser setup. So it's a time tested product. We know there's a lot of plastic products out there that we've had a lot of problems with and that I personally stay away from. So basically you have concrete and then that is surrounded by crushed stone. I have compaction specifications on the plans. So I'm very confident that this particular and it's everything's H20 loading, H20 distribution boxes. All the proper precautions and engineering concerns have been incorporated into this. This is like an excellent type of leaching product, and it's used, again, it's the time-tested product that I am very confident with.
Thank you.
Other questions or comments? Okay, shall we vote? We move to grant a local 5 upgrade approval to 310 CMR 15.221 of the State Sanitary Code, which requires a maximum of 36 inches of cover over all system components. A local upgrade approval allowing up to 144 inches of cover over the proposed tanks is requested, and a maximum of 42 inch of cover over the proposed leaching components.
Second.
All those in favor? Aye.
Aye.
Any nays? Okay, so moved. We move to grant a Title V local upgrade approval from 310 CMR 15.211 of the State Sanitary Code, which requires a minimum of 10 feet setback from a slab foundation to a leaching field. A local upgrade approval allowing a reduction from 10 feet to a minimum of 6 feet is requested.
Second.
All those in favor? Aye.
Aye.
All right, they'll let the record show. Anyone opposed? Let the record show that it's unanimous.
Excuse me, would you be able to put some language in there regarding the structural, the vendor to provide structural specifications?
Sure,
I mean,
we're going to do comments and findings, so I'm
Okay.
going to add that there.
Okay,
and then
perfect.
If we wanted
All
to
right,
talk
excellent.
about the
Thank you.
easement as well, but yes, thank you so much for reminding me. I appreciate it. Comments and findings. This is an existing 8-room 4 condo unit with no proposed increase in flow. This property does not fall within a zone 2. The system is not designed for a garbage grinder, and will remove any garbage grinders that are currently present in the condos, and the existing system is currently failed. And we also want to add that the vendor should provide structural information regarding the tanks. Is that right?
Yes, yeah.
Okay, and then about so we're not granting any property rights. And Mr. Glennon, is there anything else we should say about the easement?
No, I think that's fine. Just an awareness, and that this board is not granting any property rights.
Okay. Great. All right. Thank you.
Thank you very much. Yeah, definitely. I'm going to talk to my client about that and get a legal opinion just to protect everybody's interests. Thank you very much for pointing that out.
Thank you.
Thank you. Nice work.
All right. Thank you very much. Appreciate it. You have a good night.
Thank you.
Our second item on the agenda is introduction of new Public Health Excellent Grant Committee epidemiologist Devin Donovan. Lauren, are you reading something or is he introducing himself to us?
Oh, it's a she, and she just joined as a panelist, so
Oh, good. Okay.
looks like she's getting ready to speak.
Just FYI, I caught myself out of the house without a charger and I have 7% off on my phone. So if I disappear, that's why. I'm sorry.
Yeah, no problem. Hi, everybody. My name is Devin Donovan, and I am the newly hired Public Health Excellency Grant Epidemiologist for Southern Plymouth County. I'm working with, obviously, Duxbury, but as well Kingston, Plymouth, Plimpton, Carver, Plimpton. Did I say Plimpton already? I'm Wareham. I'm new to the area. I'm learning all the names. But I have met with Lauren and Tracy, and I wanted to come here and show my face and also just hear from you guys about the health issues in Duxbury and what is of main concern to you. And right now, my biggest focus is to, sorry about that. My biggest focus is to make a community profile for each of the towns in the collaborative to get a better idea of what's happening health-wise and what I can see in MAVEN, which is the epidemiological infectious disease reporting network. And also looking, you know, down the road to maybe do community outreach and a sort of community assessment to see the needs from there. So I really just wanted to come and say hello, and I'm looking forward to working with all of you.
So when you say doing a community assessment, can you describe what that would look like?
Sure. So down the road, this would be like a needs assessment. So we could design a survey to ask people in the community how they feel about certain public health issues. We can target certain ones specifically or do a more broad sort of opinion on, you know, what they think might be an issue. It'll really be clearer to me once I have the community profile, which will be more in depth of infectious disease and things I'm able to pull from data. But it would look maybe like going into the community either virtually via social media methods or making it aware in different community places for people to participate in the survey, and then being able to use that data to drive public health initiatives and campaigns.
Thank you.
Mhm.
And if it's okay, I'd like to just offer tick-borne illnesses and Lyme disease in particular as one of our big concerns. And that will be, I'm sure that will be clear from the data in MAVEN, but yeah.
Yeah, and you are not alone in telling me that it's a big issue. I feel a lot of the towns or many of the collaborative towns are expressing similar concern towards that issue. So it's definitely a priority and on my radar. So yeah, thank you for bringing it up because it's, I think as well I've been speaking with other regional epidemiologists who are funded through the same grants in different areas of Massachusetts. And they probably have already resources that we can adapt for each of the communities in the collaborative to really make it specific. I like to call it, there's precision medicine and precision public health, and that's really my mission, is to meet people where they are. So yeah, would love to do that.
Yeah, we're also getting into the, as you know, Triple E and West Nile season and the mosquito control. So it's a perennial topic.
Yeah, today I saw a couple of mosquitoes, and now that I'm like in MAVEN and seeing how serious it is around here, I'm going to be taking my DEET a lot more seriously as well.
Madam Chair, there is somebody in the attendees with their hand raised.
Oh, yep, please
Oh,
unmute yourself and introduce yourself and ask your question.
Sure. Hi. Can you hear me?
We can.
Okay, great. My name's Susan Schofield, and I would like to meet all of you, but it's hard to do this remotely. When are your meetings going to start happening, like in a hybrid method or in person? Thank you.
Thank you for your question. We can certainly discuss that. That's you know, I'm okay with meeting in a hybrid method. So I think that Lauren, we can make that happen.
I would really appreciate it. I know every other town committee is meeting in person or in a hybrid, so I think it's long overdue. And I would like to meet these new people. They're doing so much great work for the town. So thank you very much.
Thank you. I appreciate your comment and your question, and face-to-face is wonderful.
Yeah. Thanks. That's all.
Isn't there some kind of time frame? Like the state allows remote but I thought that maybe at the end of this year, something was supposed to happen.
I think it's extended to March 2025, but I'm not certain, but I believe but we could go hybrid. I'm very familiar with that, with the zoning board.
Well,
So that's
we have discussed this in this board.
Let's make it happen, Lauren.
okay.
I'm okay. Mr. Glennon, you have a comment or a question?
Yeah, thanks. Since we have the benefit of Devin here. Hi, Devin. I'm Brian Glennon. I'm a member of the select board. I'm this board's liaison, so I drop in from time to time to check in to see how I can help. I'm very interested in what you're observing in the short time you've been on the South Shore, and I know you gave us some highlights, but I'm very interested in knowing, well, number one, how long we have you for, and then what sorts of things are you seeing in other communities in terms of big deals? I mean, certainly Melissa properly raised, the tick-borne illnesses, that's always a big deal. Dr. Brumley mentioned the mosquito-borne stuff. Are there any other things we ought to be thinking about in the near and long term that you're seeing with some of our peer communities?
Yeah, nice to meet you, Brian, and great question. As Lauren knows, I'm very new. I started 2 weeks ago, but I can tell you definitely a lot of the tick-borne illnesses, mosquito-borne illnesses are on the forefront of everyone's mind, like you touched upon. And I'm also hearing that with the summer season coming and a large influx to this area of people with different bodies of water. Maven recently spoke about legionellosis or Legionella, which is in water that could cause infection, things like hot tubs and whirlpools. So that is also, it's rarer, but they spoke about it recently. And I'm originally from New Jersey, so not too far, but I'd have to say it's a little soon for me to tell. I got into Maven yesterday, but those are the big ones right now. And I mean, longer term, towards the end of the summer, of course, we'll be thinking about flu season again, but we're just coming out of it. But of course, it'll be back sooner than we think.
Thank you. And as I'm sure Lauren and Tracy told you, we're not shy about reaching out. So we'll look forward to seeing you a lot in Duxbury.
Definitely. And Lauren, I'm not sure how to best answer I'm funded through the Public Health Excellency Grant. So long as that is still funded, that is sort of how I continue to stay here. Perhaps Lauren could speak more on, how long, but hopefully a while.
We're level funded for at least the next 3 years, with most likely the potential for longer.
Yeah, I'll become very familiar with the area.
What part of Jersey are you from?
I'm
no.
Oh, he'll never know. I'm from northern New Jersey, Morris County, so about 4 hours south from here. Although I received my master's in epidemiology from Karolinska Institutet in Sweden.
What exit is that?
We're so far north, we don't even get an exit on the parkway.
Karolinska is very well regarded, so congratulations on that. That's wonderful.
Thank you.
Yeah, well, welcome. We're looking forward to your help.
Any other questions? Thanks. Will you come back at some time in the future and just give us a update on your work?
Definitely. And I'll be in close touch with Lauren and Tracy. And once I have that community profile, this is probably, a few months out from now to really dig deep, I will certainly try to present it to each board or speak with Lauren and Tracy about the best way to get in contact with you all to present that information.
Okay. Great. Look forward to it.
Thank you, Devin.
Thank you. I'll step down.
All right, great. Moving on to our third item is a continued discussion with the Duxbury Safe Water Committee regarding concerns to the town's public water supply.
I don't see Becky or Tanya on this evening.
Okay.
Karen, I can offer an update from the PFAS working group if that would be helpful.
That would work. Thank you.
Okay. Well, I did not attend the last meeting, which was May 6th. Unfortunately, I missed that one. Actually, that was just a water and sewer advisory board meeting, and I'm the Board of Health liaison to that group. But the PFAS working group, we are working with the town's consultants, which for what we are doing now is an initial design or preliminary design for scoping, I guess I would call it, for the wells in town that are impacted by PFAS and need to be addressed under the new federal regulations for PFAS, which are more strict than the state regulations, and they went into effect last month. So, we will be getting an update. I want to say June 3rd is the next meeting. We'll be getting an update from the consultant who's working on design for the wells, initial design, because our hope with this group, this PFAS advisory group, is to look at strategizing which well to tackle first, or how to go about this process to get the most benefit as quickly as possible and tackle this in an appropriate manner, because there's a fair bit to do. And we also have the town has a Weston and Sampson, and they are looking at some hydrologic modeling of groundwater to investigate how the plumes of PFAS may be moving in the groundwater. And that will offer some additional information, hopefully, on as we draw groundwater up from our wells, how the PFAS is moving within the water, the groundwater. I think that's the update.
Thank you. That's great. And then I know that in the near future, there's going to be some grant writing, right, to try to tap into some of the resources that are available for the mitigation.
I hope so. Yeah, I think we need to get moving on that. The largest source of funding for this is the state's state revolving fund for water projects for drinking water. And that has annual set deadlines that we would need to meet. So we'll need to coordinate and manage this effort so that if, whatever we're moving forward with, that aligns with getting on what's called the intended use plan for the state, so that we can make sure that we're hopefully getting on the intended use plan to make sure our funding requests coincide with those deadlines. So
Great. We don't want to be left behind.
exactly.
Thank you. That was great update. And thank you so much for being on the committee as well.
Oh, thanks.
Any questions for Melissa? Moving on to our fourth item, which is Lynn Greenwood to discuss several items.
Hi.
How are you?
I'm Lauren. Is Kevin on? He's not on. Okay. So, because one of the points I was going to speak about was Kevin McKernan's findings. He is a genetic scientist. He was a lead on the genome project at MIT for his whole career. He's one of the top genetic scientists in the country, and I was going to share his data, but he actually is going to join us. So I'm going to leave that. He was just getting off a flight, so Lauren's just going to keep it. He told me he's off the plane. He just needs time to get set up on his computer, so he's at Logan. So
Ms. Greenwood, can we go in order? Is that okay? I think your first order is Lyme disease. Can you
yeah,
speak
I'm
about
gonna
that
I'm gonna
first?
talk about that. I'm just saying I'm gonna let Kevin talk about if that's okay, because since he's the one that I was gonna discuss his findings, but he actually speaks about it from around the world, and he's actually gonna get on with
Okay.
us. So
Thank you.
just so I might skip that number 3, and then we'll go back to him once he gets logged. Hopefully,
Fair enough.
or just let me know if he logs on. So for the Lyme, and I'm glad that Devin was on. So I'm a Lyme disease survivor. I had about 8 years ago, I was disabled for about 6 months with Lyme disease. So I'm fairly educated in the subject. I've been researching it for 8 years. And when I know we always talk about the tests, and there's just a lot of things I want to get on the record. So there's a documentary called The Quiet Epidemic, and I don't know if, whatever, I won't do that. That in that it's 2 filmmakers that both had Lyme that created this, and they discovered, and there's an investigative journalist in the documentary, and I recommend everyone to watch it, because the 2 people that they followed, one's Dr. Neil Spector, who's amazing, who had Lyme. He was a cancer researcher and then went over to Lyme. They FOIA'd CDC emails, and in that documentary, they revealed that the Lyme test, the CDC took 2 markers out of the Lyme test when they originally made it. And that's why I guess we all know someone who has Lyme, no one tests positive. It's very rarely do you test positive. And that's the reason why. So the test is compromised. So I just want everyone to know that, because I know that we always report how many people have Lyme. I never tested positive, even though I was completely disabled from the neck down. My doctor said there's nothing wrong with me, even though I couldn't walk. I ended up working with the functional doctor and treating it myself. So it's just something that needs to be in discussion. I don't know where the Public Health Department of Massachusetts stands on it, knowing that it is a compromised test. I know that everything right now is kind of treated to the test. Like I said, I had to just do everything on my own and pay out of pocket because I didn't test positive. So I just want to get that on the record. There's also just, I could talk about Lyme all day, because I've educated, I know how to cure Lyme. It's a parasite. That's really, you have to treat it like a parasite. You can't vaccinate out of it. I know that Barry from Plymouth at one of the meetings talked about the vaccine, but you can't vaccinate out of a parasite. That's so. And there's a documentary called Under Our Skin. It's a 2-part. The woman who was a part of that, it was 2008, 2015. She just came out with a book called Bitten. So I do recommend, to get educated, all these people that they're just amazing, done amazing research. The second point was Meryl Nass, Dr. Meryl Nass. I did share a video, a 1-minute clip. I hope everyone watched it. I don't know if, I just want to get that on the record too, where for the bird flu vaccine, there's 3 that have been approved. They truly were approved for emergency use only. The Ardens is the one that she spoke about in her video, that in the clinical trials, 1 in 200 people died. So I know that there's a lot of talk about bird flu, and I think we need to I'm trying to get ahead of it, that, clearly the adjuvant that was used in the vaccine has never been approved for human use. So just so that everyone's aware of that. And then on the Public Health Excellence Grant, and this is tied into the SAFE Act. So again, Devin has been hired through that grant. There's some people that, as it is now, where, it's very hard to have conversations with the public board here, because everything's remote. These regional boards, it's obviously we haven't been able to have any, there's no public comment yet because they're not established. It's taking it out of the community. They've created the Public Health Excellence Grant, and then the SAFE Act is the next piece that they're trying to put through the State House right now. It has very broad language, and it puts the power to make public health emergency decisions into 2 unelected officials' hands. That's the head of the Mass DPH and the head of environmental protection. how is it being funded going forward? I know that the grant, there's 200 million that was put aside for it. 100 million is for tracking and tracing. And what happens when that runs out? Because adding roles where they're not being funded going forward. That's so I don't know if has Kevin shown up yet? No, all right, I'll text him, and if not, obviously he'll do a way better job than I will to speak about it. Hold on one sec. I'm just but I do hope with the new epidemiologist that we could have some more discussion on Lyme, and it's just it's not a simple test. It doesn't work. All right, so I mean, what I might do is, if he can't, like I said, he was just getting off a flight. It would be nice to have him talk about it. So maybe get him on the next agenda if he doesn't log in, because we're very lucky to actually have him to join us.
We can certainly have him on the next agenda.
Okay. I've spoken extensively about his findings at the school committee meetings, so they're aware. All right. Any questions online?
No, thank you for coming, and thank you for sharing your thoughts and your information. And we certainly look forward to our epidemiologist and her findings. And any questions for Ms. Greenwood?
Lynn, thanks for your information. And I recently read a book, Firsthand Account on Lyme. Journalist Ross, I'm going to butcher his last name, Dutot, I believe his name is, but
What was it?
Ross Dutot, it recently came out. Anyway, it was very good, and it was it's important to know about how this is affecting people. So thank you for bringing it to our attention. Appreciate it.
Thank you.
All right. Our next item, which is number 5, are health agent updates, and Lauren will be providing those for us this evening.
Madam Chair, actually, Kevin McKernan just
Did you
joined.
just log in?
Okay.
Would you like me? Okay, I'm going to promote him.
We'll
Thank you, Lauren.
revert back to data regarding the COVID vaccine, and look forward to hearing that.
Hello, everyone. Do I have, am I interrupting? Is this the right time to bring information forward?
Yes, if you could just identify yourself for the record, and we're looking forward to hearing your information.
Okay, my name is Kevin McKernan. I have a 28-year background in genomics. I used to be the team leader for research and development at the Whitehead Institute for the Human Genome Project over at MIT. I've built several genomic companies. I have 61,000 citations to my name, dozens of patents, and probably 50 or 60 peer-reviewed publications in the field of genomics and PCR. So about a year ago, maybe a little bit over a year ago, February of last year, we discovered DNA contamination in the Pfizer and Moderna vaccines. In the last year, that data has now been replicated in 6 labs around the world, and very recently a lab in Germany, who has recently published this through a peer-reviewed publication process as well. We have Dr. Sin Lee in Milford Molecular in Connecticut that have replicated this. We have Dr. Philip Buchholz, who's a tenured professor of genetics and cancer down at USC in South Carolina. We have Bridget Koenig out in Germany who's reproduced this. There's now at least 6 labs that have reproduced this decontamination or this contamination issue in the vaccines. What does this mean? When there is excess DNA in these vaccines, this DNA is wrapped in these lipid nanoparticles and gets into your cells. It has been published by Drayman et al. That this particular sequence that's in the Pfizer vaccine actually interacts with P53, which is your tumor suppressor gene. This is a serious concern. There has been an uptick in cancer post-vaccination. It's right now correlative. We don't know if it's causative. We do know that there has been publications from Wafik El-Diari, who is the head of the Cancer Research Center down at Brown University, that the spike protein itself is downregulating p53. Now we have a DNA contamination that is also interacting with that gene. We don't know what this means, but it shouldn't be there. There's another publication from Dean et al. That demonstrates this SV40 sequence is actually a nuclear targeting sequence. That means that it is used as a gene therapy vector to drive DNA into the nucleus of the cell. Now, various regulatory agencies have come out and admitted this is there. The FDA has admitted this DNA contamination is there. Health Canada has admitted it, and the EMA has admitted it. What is important for the public to know is that this sequence was hidden by Pfizer from the regulators, and the regulators have admitted that they have been deceived by this. This is against their own guidelines. This DNA should not be, any DNA that has a promoter or an open reading frame in a plasmid needs to be disclosed to the FDA and who? The World Health Organization. Pfizer did not do this, and there's actually evidence that's emerged that they intentionally hid this from the regulators. At this stage, we have emails that have been accessed via the Freedom of Information Act that demonstrate the regulatory agencies are telling the public that this DNA is of no consequence while they are scrambling internally to get rid of it. So these shots are not fit for purpose. They are danger for consumption, and they should be, any mandate should be avoided going forward. Finally, on these vaccines, there is limits for DNA contamination in prior vaccines. It used to be 10 picograms back in 1985. The NCVIA Act, which is a liability protection that Reagan offered to the pharmaceutical industry for vaccines, since that has gone into place, the DNA contamination limits have gone up 1,000-fold. This DNA contamination was considered acceptable because DNA injected into your bloodstream has about a 10-minute half-life. This is not DNA that's injected into your bloodstream. It's DNA that's wrapped in lipid nanoparticles. It is protected from degradation. It gets delivered directly to your cells, has the capacity to interact with p53 and get directly to your nucleus. This is a risk for genome integration. If any of this hits a germline cell or a stem cell, we will see this in children in future generations. Those odds are unknown right now. They're probably very low. However, the risk of cancer alone, I think, is a reason why people should avoid these at all cost until further work is done to understand the consequences of this contamination, and until it's fully understood how the regulatory agencies can quantitate this and hold Pfizer and Moderna to account for these contamination events. So if there's any questions you have, I'm happy to answer them. That's kind of the quick and condensed version of this, but there are several other resources I can point you to that can give you more information on the nature of this. For those perhaps questioning how this happened, the clinical trials were run on material from Pfizer that were amplified DNA. They used PCR, a process to amplify DNA, to effectively make it very clean and very small amount of DNA that would potentially end up in these shots. When they had to scale up this for mass use, they had to switch to a new manufacturing process. That new manufacturing process never went through clinical trial. Now, when you're making biologics like this, the process is the product. All right. So when they changed the process of brewing this vaccine in E. coli, they should have gone through a new clinical trial. That never happened. All right. So there's all types of risks, from DNA contamination to endotoxin risks that could potentially be in these shots that have not been properly trialed. And so that's I'll leave it at that.
So Kevin, this is David Browning. I'm a physician as well, so thanks for bringing this to our attention. But so I understand that that's concerning what you bring up, obviously, but I understand there's a correlation. But is there any data that suggests it's causative? I mean, do we know that those increased rates of cancer are due to the DNA in the vaccines?
No, we don't have causation yet. To get causation, we would need to fulfill the Bradford Hill criteria for causation, which means that the incidence of cancer has to occur fairly quickly since vaccination. There does seem to be a temporal correlation right now with the increased rates of cancer in the vaccine program, but we can't pin that entirely on the vaccine itself. There's been concerns over late screening and other artifacts of the lockdowns and the pandemics. Now, what is interesting is the types of cancers that are emerging today are not the type that you can potentially screen your way out of. So there's a good debate there. But the other aspect of this of Bradford Hill's tenets of causality is that we need to show some type of dose response. And that has not yet been done. We are still in the stage of being able to measure this in the vaccines. We now need to measure this in actual biopsies. We don't have data of this in biopsies. There has been some preliminary work that we've put public. It's not yet through a peer review process, so take it with all that caution. We have applied the vaccines to OVCAR3 cell lines, and we can see the DNA is getting into the cell. We can see the DNA is replicating in the cell. That's a concern. There's an mammalian origin of replication in the vaccine, which means when it gets into the cell, it makes more of itself. So these 10 nanogram limits are a little bit of a farce, because if you can put a vector in there that can amplify, the narrow hole you have as a regulation is suddenly meaningless, because the plasmid can amplify once it gets into a mammalian cell. We have some putative integration events in chromosome 12 that need to be verified with long read sequencing. So I wouldn't take that to the bank at the moment. And these are in fact OVCAR3 cell lines. They're ovarian cancer cell lines. So this is not the perfect model. There are laboratories that are anonymously taking samples from patients. They cannot report back to the patients. Philip Buchholz is one of them. They're mostly taking biopsies to sequence the biopsies and see if any of this vaccine has been integrated into their tumors. I suspect that's going to take a long time. Oftentimes you need CLIA laboratories and IRBs to oversee this, and he cannot report any genetic information back to the people who donate the samples to him. He's at a stage where he can only take in anonymous donations at the moment. So that's kind of the state of where we are with understanding the clinical implications of this. I think right now the main concern is that we know the regulations are being breached. We also know they're not fit for purpose, and we can see that the regulators seem to be in a position here of perhaps covering for the crime, if you will. They are not actively addressing this, despite multiple laboratories over the world reporting it, and they themselves having admitted that Pfizer sort of snuck this one through them. They were given the DNA sequence of the vaccines. They didn't look at that carefully. They were also given a plasmid map, but the plasmid map had these SV40 components omitted. And that's impossible. And these days, when you put a plasmid into a commercial software that annotates these things, SV40 is the first thing that pops up. So someone at Pfizer had to go in there and deliberately erase that sequence, hide it from the regulators, and hand them a plasmid map that was missing critical information about a sequence that contaminated the polio vaccines many years ago. That polio vaccine contamination has been a controversy for 20 years in the literature as to whether or not it's causing cancer.
Melissa, you have a question or a comment?
Yeah, I was going to, perfect segue. I was going to ask Kevin about the SV40 sequence. With the last, my understanding, and I'd love for clarification on this, my understanding is that the last time the full SV40 sequence was used was in that polio vaccine in the 1960s. So is this,
that
are
was
we
the full
looking
virus,
at,
though? Just to be clear,
Sorry?
that was a 5 kb virus that the
Right.
entire virus was there. This is only some of the genetic elements people have lifted out of that virus to use for gene therapy vectors. So it's an SV40 promoter, the origin of replication, what makes that DNA replicate in a mammalian cell, the enhancer, which drives it into the nucleus, and an SV40 like polyase signals. There's about 4 pieces, about 500 bases from the SV40 virus that are in the Pfizer vaccine. The thing is, they don't need to be there. Moderna does not have these sequences. Only Pfizer does. So Moderna is case in point that they're not needed to get the job done.
So yeah, so those are components of the SV40, but not the entire SV40 sequence. So given the history of SV40, do we know which components are responsible for tumorigenesis or potential?
Yes, that's a good question. Most of the literature will point back to the T antigen, which stands for the tumor antigen in SV40. Now, because of the polio vaccination, a large portion of the population is in fact seropositive for the T antigen already.
Okay.
So that's already in many people. Now, the T antigen is what drives replication of the SV40 origin. When the T antigen's around, it kicks on the promoter, it kicks on the origin, which are the two things that are in the vaccine. We also have this work from Drayman et al. That shows that this SV40 promoter binds the P53. Now, we don't know what it's doing to P53. We don't know if it's upregulating it or downregulating it, but the fact that it's touching it at all has many people concerned.
So is that more of the concern here, is the relationship of the SV40 promoter to P53 rather than having the sequence of SV40 that would potentially on its own be problematic? Is that
So there are several concerns here. One, just in general, you can look up papers on cytosolic DNA, and you'll find many references to cancer. So just flooding cells with foreign DNA can trigger like an interleukin cascade and something known as the
Okay.
CGAS and STING pathway. Sometimes that can be pro-oncogenic. Sometimes it can lead to apoptosis in the cell. So that's one concern. If it gets into the nucleus, it can integrate, and if it integrates into the wrong place in the genome, you can have oncogenesis. In fact, Moderna's, this is not my pet hypothesis. If you look at Moderna's patents, they invented techniques to remove the DNA, and they are better at it than Pfizer. They invented techniques to remove the DNA because of their concern over insertional mutagenesis. It's written right in their patent. Stephen Bancel, the CEO of Moderna's name is on the patent. They know about this. They're concerned about it. They're inventing tools to limit it. But unfortunately, none of the regulators are actually double checking this work. They're just taking the word of the manufacturer. When the manufacturer tells them that it's below the limit, they believe them. And at the same time, they've given these manufacturers liability shields. We've measured it, and it's not below the limit. It's well above it.
So if I understand, there are several concerns with this plasmid, not just the SV40 sequence. Is it that it's promoting replication in the cell, that the plasmid components could be offering a challenge to P53? I'm very curious. So,
Yeah, there's a couple areas of concern here. I think
Yeah.
the P53 thing is the thing that has my most of my attention. Now, there's a couple other
Okay.
points people have brought up. There's a kanamycin and neomycin antibiotic resistance gene in the plasmid
oh, sure.
that was not in the first trial. So the RCT that was performed on 22,000 people didn't have this DNA contamination, and so that was not present. Now we have done Oxford nanopore sequencing on this, so we have an understanding of the fragment length distributions, and some of the molecules approximately, we had 1 in 400 of the molecules are over 2,000 bases long, and so that's enough to encode the entire antibiotic resistance gene. I think 1 in 50 were over 1,000 bases long.
But don't most of these plasmids contain those antibiotic resistance genes? Isn't that pretty common?
Oh yeah, absolutely. You have to have them, otherwise
Yeah.
they can't replicate, and the
Right.
coli will throw them out. So, yeah, I don't know what to think of that other than if that were to get into your gut microbiome, microbiome, you may end up getting some antibiotic resistance, bacteria present in your gut. But I think that's more of a long shot, just because most of the fragments are in fact very small. They're below 200 bases, most of them. I think the mean size is 214. Now, the FDA does have regulations on the size of this, that the stuff under 200 they don't care about, but that's because they devise those regulations when they're injecting DNA, assuming it's naked. And naked DNA gets digested at the ends, and so short molecules get digested very quickly. That's not going to happen to this DNA. It's wrapped in a lipid nanoparticle, and it's going to get transfected and thrown into your cell. And actually, the reverse problem occurs. The shorter the DNA is, the more of like a buckshot it is against your genome. When you chop up DNA into lots of bits, you create lots of sticky ends, and it's those sticky ends that are reactive to your DNA. So in fact, it's worse if you chop the DNA up into small pieces and put it in an LNP and throw it against your cells, because you're going to have a lot more 3' and 5' ends of the DNA that can potentially integrate with your genome. So the small size that they have is really an outdated regulation that did not consider this transfection vehicle that moves this DNA directly into your cells.
I'll stop there and let somebody else speak in turn.
So what would you advise for people that have underwent the vaccine or taken the vaccine? Do you have any advice, general advice?
So I'm not a physician. I don't want to hand out medical advice in this. I wasn't, I apologize for not actually knowing the context of this. I was just asked to come and speak about what I found. And we don't want to spread panic here. I think if you've not had any adverse events, don't worry about this, live your life. And I think that's because there are, in fact, a lot of people who have had these vaccines with no effect. And we've seen data that there is a lot distribution problem. Something like the Schmeling paper is what I have to reference here. And the vast majority of the adverse events are concentrated in a small number of lots. So and we have seen this when we've surveyed about 30 lots now, and the DNA contamination varies 1,000-fold between the lots. So some of them are really clean, some of them are 1,000 times more contaminated. We don't yet know if that's correlated with adverse events, but it is a sign that the manufacturing process is varying tremendously, and there could be other contaminants. Usually, when you see DNA contamination, in my experience, having run run a lot of plasmids in my life, it's a sign that there's E. coli contamination too, like endotoxin. And so I view the plasmid contamination also as a proxy for potential endotoxin contamination. Endotoxin is if you inject that into someone, you see anaphylaxis shock. Like the folks that you were perhaps seeing on TV dropping right after vaccination, that was probably endotoxin contamination in one of the vials. It's a very pro-inflammatory compound from the cell membrane of or cell wall of E. coli. So the plasmid is just a canary, maybe just be a canary in the coal mine for the variants going on in the manufacturing process. And some of the lots that are really dirty may have a lot more endotoxin. So what to do about this? If you did not have adverse events, I would not pay attention to this. I would not use any more of these until they clean this up. The pandemic's over. The risk is extraordinarily low, particularly for children. And most people have some level of natural immunity by now. And yes, there will be variants, but your natural immunity will be very good at dealing with variants. The challenge with these vaccines is they're only encoding for a really small region of the virus, so it's easy for the virus to get around them. When you get natural immunity, you get immunity against the entire virus. So when there's a couple changes, your body still has a good handhold on it.
Thank you. Any other questions or comments?
There's, Madam Chair, someone with their hand raised, Mary Gammons. I'm gonna allow her to talk.
Hi, can you hear me?
We can, if you could introduce yourself before you ask
I
your
will.
question.
I am Mary Gammons. I am a Duxbury resident. I am vaccine injured by my second Moderna. I have testified at the State House several times. I am 3 years out from my second Moderna shot and still dealing with all the side effects of my vaccine, COVID vaccine injury. I've heard Kevin, I know Lynn. I just wanted you to know that there are people out here in your town who are vaccine injured, and we are still trying to recover huge amounts of out-of-pocket expenses. I'm a 78-year-old senior, but in great health until I had my vaccines. It has been very expensive because nothing is covered. Everybody alienates you. Nobody believes you. And it's been a very difficult journey for 3 years. And I just want you to know that there are people in town who are going through this. And I am an RN, so I have a medical background in public health and in OB, PD, and public health. Thank you.
Mary, I'm sorry to hear this unfortunate news. You are not alone. There is work from Bruce Patterson's lab that has shown spike persistence in vaccinated people out 245 days.
Yes, I am 3 years out.
Yeah,
my second shot was March 28th of 21, and I had never took another one. And my husband also had a blood clot after he went and got a booster and got a blood clot. So I can only share that with you as a town resident.
There are some local Massachusetts residents here that might also be another source of information for Duxbury.
Right.
I would point people to John Bodwin. He has done an excellent job getting the death certificates for every Massachusetts resident for the last, I think, 5 years. And so he has been documenting what is actually causing these deaths. And he has a very interesting bit of information in regards to the increased all-cause mortality that has occurred after the vaccine program's gone into place, and how some of that is getting fraudulently misclassified as COVID. So this may not be really been aware and apparent in the news. I'd also let everyone kind of keep in mind, we are in the hotbed of pharmaceutical revenue. We have both Moderna, Pfizer in Massachusetts. We have Thermo, who runs all the PCR revenue here. So this is going to be the hardest neighborhood in the world to get people to open their eyes to what's going on here, because there is so much money pouring into this state supporting this program.
Thank you, Kevin. So, I wanted you to come speak because, because of people like Mary, people who are injured, people are still being required to get vaccinated. And then, I've spoken extensively about this at the school committee meetings, and that just obviously, it matters when it comes from you. Just to, it's something going forward. People need to be aware that we need to stop injecting until it's figured out. So I appreciate it. And John Bodwin, actually, because we work with John a little bit, my group, Health Rights Mass, and he actually came to Duxbury and spoke at the library and presented all his data.
Oh, great.
Yeah.
So you've seen this. Yeah.
Yes. So
Yeah,
thank you.
this is not something that makes it out into the news. I'm sure it's not gone unnoticed by anyone here that almost every basketball game has Moderna on the boards, and has brought to you by Pfizer on every other football game. So they have a very strong influence on the news and how this is getting spread. What's not as apparent to most people is they have that same influence in the scientific journals. The journals receive a tremendous amount of money through advertisement from these pharmaceutical companies, and it's very difficult to get this type of information published. So there's a lot of scientific censorship going on about this. It's slowly coming out, but it takes a lot more time for something that goes against $100 billion revenue stream for it to come through any of the news agencies. So if you only heard about this now, that's not your fault. There is a very strong pharmaceutical marketing engine that is ensuring this word does not get out, and that the people associated with it are tarnished, trashed, and ridiculed.
Thank you. Any other questions or comments? Well, thank you for your time, Mr. McKernan. Thank you, Ms. Greenwood, and thank you, Ms. Scammons, for sharing your story. We really appreciate it.
Thank you.
Okay, take care. Thank you.
Lauren, we're at health agent updates.
Yes, Madam Chair. So I have the stats from our public health nurse, Kathy Carney, and these span from dates March 21st, 2024 through May 15th. For COVID cases under the age of 5, 1, over the age of 5 and under 18, 3, and then over 18, 14, for a total of 18 cases. For Lyme, we have 5 probable and 8 suspect. For influenza A, 9 cases. Influenza B, 9 cases. Hepatitis B, 2. Hepatitis C, 1. Anaplasmosis, 1. Norovirus, 1. And Shiga toxin producing organism, 1. As for our department, we are busy. We're scheduling and inspecting the semi-public, semi-private pools. We have about 10 of them in town, and they all want to open for Memorial Day weekend. Staying in line with conducting our restaurant inspections, seasonal restaurants and food trucks. And in about a month, we'll start the weekly sampling of our 5 bathing beaches. And then the last thing Tracy asked me to mention is that the next Duxbury Bay Area Regional MRC training will be next Thursday, May 23rd at 6 p.m. And that'll be at the Senior Center, 10 Mayflower Street. The program, which is titled Understanding Alzheimer's, Dementia, and Healthy Living for Your Brain and Body, will be facilitated by Jen Hoadley from the Alzheimer's Association. All I have.
Mr. Glennon, you have a question or a comment?
Yeah, just a question to follow up on something that Lynn raised earlier. Lauren had mentioned in the stats there were some positive tests for Lyme. And Lynn, you had mentioned earlier that Lyme notoriously is not caught on tests. So I was just curious, and I don't know if there's an answer to this. It just a little 10-watt light bulb went off over my head, where we're saying, you know, there are some positive tests, but do we now extrapolate on top of that and say, well, because there are 10 that came in through a test, we think it really is something higher? Or I don't know, Lynn, maybe you want to talk about that, or not to put anybody on the spot, but I'm just curious how this.
No, it's I have to say, when COVID hit, I looked at the CDC website a lot, and I went and looked into the Lyme, and this is really more a public health question, probably down the road. And I don't know if they've updated it. They had put in up through, I think, 2018 or 2019, and there was thousands of cases in Massachusetts. And then all of a sudden in 2018 and 19, there were 3. And there was comments about they changed the way the state measured it. But I mean, I looked at it and said the year that there was 3 in Massachusetts, I had 3 on my street, you know? So I don't know. I haven't looked to see if the CDC or Massachusetts, if they've been updating the data, because you know with COVID a lot of stuff was not updated online. So that's, yeah, I mean, generally the 2 markers, there's 2 markers that were pulled out. That's why it is good to watch that documentary, because they explain a lot. I mean, I didn't know that about the test until I watched it. And yeah, most likely there are more. I think it, you know, it goes in waves.
All right, thank you.
So thank you.
I think, you know, any test, I mean, there are false negatives and false positives. I'm just taking a look at the latest thing I see on the CDC is from the 2019. And they say during the first 4 to 6 weeks of the infection, the test can be negative, even if you have it. So there are definitely some false negatives. I don't know the rates or the percentages or the sensitivity or the specificity or what the magnitude of that is, but clearly there are some that are missed.
Generally with the Lyme, what they find, again, in my experience, is you test positive early, and then what happens is it hides. That's when, and I actually was dormant for about 2 years, and then something triggered it, and then it took me 10 days. What happens with Lyme is it also, no matter what, even if, you know, they took 2 markers out, but maybe you have some other markers that show up, it hides, it covers itself with biofilm. So the longer you have it, if you don't test it, I mean, it's a blessing if you actually get a bullseye, because then you know right away. And if you catch it early with Doxy, when you have it right away before it spreads in your body and then hides and gets covered in the biofilm and it's hard to get it at, then you don't test positive. I never tested positive, but you know.
Some good practice to consider is when somebody is bitten by a tick, it's within the 72-hour time frame. We're in an endemic region. If you're not allergic, 200 milligrams of doxycycline.
The other big thing is testing the tick. So about 50% of the last time I checked, God knows if it's changed, but about 50% of ticks are positive for Lyme. So the first thing, I mean, we do it all the time with we send it off. Our doctor, we do a DO and they check. So that's actually, it's one of the, because then if the tick's not positive, you don't have to worry about it. So that's very easy and expensive.
Dr. Bromley, I was just looking at the sensitivity of the line. I know it's low. It's pretty low. You're absolutely right about that. That's it at least takes 3 weeks, and then sometimes it still doesn't go positive. So that's accurate. Ms. Gammons, did you have a question or a comment?
I had, can you hear me?
We can.
Okay. I have just one more comment. My son, who is a physician in Vermont, who was head of the Olympic teams on Killington and did all the COVID stuff, said the COVID tests were also altered. So just as an FYI, from an anecdotal perspective, that was his impression, that they had lowered so that people tested COVID when they really didn't have it. So just, it's anecdotal. I don't have anything other than what my son reported to me.
Thank you. Thank you for sharing that. We appreciate it. Any other questions for Lauren before she goes on to the minutes? On to the minutes.
Okay. I'm just gonna read, should I read off all of the dates or do you want to approve individually?
Maybe read the date and then we can approve.
Okay, so we have April 29th, 2021.
Approve.
Approve.
Anyone not in favor of approving? I hear no nays.
Okay. February 4th, 2021.
Approve. Any nays?
Okay. February 18th, 2021.
Approve. Any nays?
These are in order. January 21st, 2021.
Approve. Any dissent or nay?
Okay, we have March 25th, 2021.
Approve. Any nays?
January 20th, 2022.
Approve. Any nays?
And January 19th, 2023.
Approve. Any nays?
And last one, May 18th, 2023.
Approve. Anyone? Any nays? Thank you. So I just want to say, this is not on the agenda, but I'm going to let you know that both Lauren and I are going to be on site next month at the meeting. So we'll do a hybrid meeting. So those of you that want to join us live can do so. Otherwise, we'll conduct it in a hybrid format. All right, I make a motion to adjourn.
Second.
All those in favor? Aye. Anyone opposed?
No, I'm in favor. I'm in favor.
You want to stay longer, Bruce? Thank you. I hope I'll see you in person next month. So anyways, thank you everyone for your time and attention. Appreciate it and have a good evening.
Thanks. Good
Yeah.
night.
Thank you.